foods, fatty fish, salmon, sardines, mackerel, leafy greens, spinach, kale, arugula berries, blueberries, strawberries, raspberries, nuts and seeds, almonds, walnuts, flax seeds, chia seeds, olive oil. Contains oleocanthal, an anti-inflammatory compound. Turmeric contains curcumin, a powerful anti-inflammatory garlic, and onions natural. Anti-inflammatory agents, whole grains, brown rice, quinoa, oats, beans, and lentils. Good plant-based protein with anti-inflammatory property. Green tea contains polyphenols that reduce inflammation. Bad foods, refined sugar, sweets, pastries, soda, processed foods, chips, instant noodles, fast food, red and processed meats, sausages, bacon, beef, refined carbohydrates, white bread, white rice, pasta, fried foods, deep-fried snack, fast food, dairy, food, cheese, excess alcohol may increase inflammation and worsen healing. Hydrogenated oils, margarine, shortening, processed snacks, artificial additives, preservatives, food, dyes, MSG, excess salt, too much sodium can affect joint and tissue health. Bonus tips: stay hydrated. Water helps maintain tissue flexibility and function. Maintain a healthy weight, less pressure on joints, especially hands and fingers. Supplements: consider fish oil, turmeric, curcumin, or glucosamine. Do you know what causes trigger finger? And do you also know how to cure it? If you don't, watch this video to the end so that you can understand what causes trigger finger and what are the ways to get rid of it. The condition gets its name from the fact that the finger gets stuck in a bent position just like a gun trigger. Trigger finger is a condition that occurs when the tendon in your finger gets inflamed or swollen. This swelling leads to the formation of a nodule, and this nodule can be felt as a lump right where the tendon passes over one of the finger bones. When this happens in your thumb, it's called trigger thumb. Usually, a doctor can diagnose trigger finger just by examining your finger and asking you about your symptoms. Treatment for trigger finger often involves a combination of rest, medication, and physical therapy. Rest is important to allow the inflamed tendon to heal. Physical therapy can help to stretch and strengthen the tendons in your finger. A physical therapist may also teach you exercises to improve your range of motion and reduce the risk of recurrence. In some cases, a doctor may recommend a steroid injection to reduce inflammation and help the tendon heal. Surgery is rarely needed, but it may be an option if other treatments are not effective. However, in some cases, a doctor may order an imaging test such as an MRI to rule out other conditions that may be causing your symptoms. Trigger finger, also known as trigger thumb, is a condition in which you may feel a pop-in or lock-in sensation in your finger, especially when you try to straighten it. If you found this video helpful, please leave a like below and share this video with your family and friends. Do not forget to subscribe and hit the notification bell icon to get notified whenever I post a new video. And be sure to check out my other videos here. I've got a ton of health tips and information that you can use to live a healthier life. Thanks for watching and stay healthy. It may make it difficult for you to perform everyday tasks, such as buttoning a shirt or making your bed. The best way to prevent trigger finger is to avoid activities that cause repetitive stress on your tendons. If your job requires you to perform repetitive hand movements, be sure to take breaks and stretch your hands regularly. You can also wear a splint or brace to support your hand and wrist while you're working. If you play a musical instrument, be sure to practice good posture and technique to avoid putting unnecessary strain on your fingers. In severe cases, the finger or thumb may get stuck in a bent position and may require you to massage or manipulate it to straighten it out. Trigger finger or thumb is something that can really annoy you. The condition is most commonly caused by overuse or repetitive stress on the tendons of your fingers. This type of injury is common among construction workers, mechanics, and assembly line workers. However, trigger finger can also occur in people whose work involves playing a musical instrument like the piano or guitar. Household activities such as ironing or knitting can also put a person at risk of developing trigger finger. People who have diabetes are also at an increased risk of developing trigger finger. This is because high blood sugar levels can cause the tendons to become thick and stiff. Another cause of trigger finger is having an abnormal thumb or finger anatomy. For example, if the pulley system in your fingers is too tight, you're more likely to develop trigger finger. Certain types of arthritis, particularly rheumatoid arthritis, can also cause the development of trigger finger. All right, let's take a look at the causes of trigger finger. The most common symptom of trigger finger is a noticeable lump or bump near the base of your finger or thumb. The affected finger may also feel stiff and difficult to move. You may also experience pain when you try to straighten the finger or thumb. The condition can also cause a snapping or popping sound when you try to move it. In severe cases, the finger or thumb may become stuck in a bent position and may not be able to be straightened until the tendon is manipulated. All right, now that we know the causes, let's talk about the symptoms of trigger finger. Now, let's take a look at how trigger finger is diagnosed. All right, once diagnosed, let's talk about how trigger finger is treated. All right, now that you know what causes trigger finger and how it's treated, let's take a look at some ways to prevent trigger finger. All right, that's all